Medicare enrollees looking for a Part D plan may need to spend some extra time looking around this year during open enrollment. Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Joining me today is Rich Daly, a senior editor at the Healthcare Financial Management Association. Rich, Medicare Part D plans, as many viewers will know, is the prescription drug coverage that comes with traditional Medicare. Prescription drug coverage with Medicare Advantage is something separate that we're not talking about today. But the number of Part D plans that have been available for traditional Medicare enrollees has dropped quite a bit in recent years. What's going on?
Next year, there's going to be only 360 plans nationwide. That's a 22% drop from last year and a 50% drop from 2024. The deal is that the Inflation Reduction Act increased cost and risk for the drug plans by introducing an out-of-pocket cap, which is good for enrollees, but the law also shifted more responsibility for high drug costs onto those plans. The result is that their profitability was lowered, and so a whole bunch of plans have left the market as a result of that.
So these plans are offered on a regional basis. So you don't have your pick of the 360, you have a pick of, I think I read it was about 8 to 10. What does this mean for the average patient as they're looking for one of these plans?
Yeah, there is going to be fewer in any given state. And you're right, the fewest is 8 in several states, 8 to 12 sort of is the range nationwide. Now, because there's 8 plans, it doesn't mean there's 8 companies offering those plans. The number of companies offering plans is only 4 to 6 in each state. So you have to shop between those plans to look at your options available.
So for people watching whose Part D plan might be going away or they're shopping for a new one, what are their options?
Well, the first thing is make sure you look. Historically, only about a third of Medicare beneficiaries even shop among the available drug plans. So given all the turmoil and change coming up for 2026 coverage, it's doubly important to actually go and shop among the different plans to see what's available. The reasons for doing that is to make sure, for instance, that your drugs that you need are included in the drug formulary. And then also, what are the out-of-pocket cost variations? Things like the deductibles or the copays. There's been a big increase in the out-of-pocket among some plans as a way for these drug plans to actually maintain profitability. So that variation is very important to nail down so you don't suddenly, as the year rolls along, realize you've got a whole bunch more to cover out of pocket than you did maybe this year. You should check the price variations in terms of the out-of-pocket costs. After the $2,000 out-of-pocket cap went into effect in 2025, a lot of drug plans actually ended up switching from offering zero deductibles and co-payments for preferred drugs to fewer zero deductible plans and actually much higher co-insurance. The actual monthly premiums paid by Part D enrollees in standalone plans in 2026 will have a big variation. Those can range from $0 premiums to more than $100 in most regions.
That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.